First here at 5, we start with that warning from federal health officials to pause use of the Johnson & Johnson coronavirus vaccine. The FDA and CDC issuing the recommendation today, saying they were investigating a rare and severe blood clot that could possibly be linked to the virus. Here's what we know right now. There are 6 reported cases of the clot out of the 6.8 million Johnson & Johnson shots given across the country. All of them women between the ages of 18 and 48. They all started feeling symptoms 6 to 13 days after getting the 1-dose Johnson & Johnson vaccine. One of the patients has died. Another is in critical condition. We do know none of the cases is here in North Carolina.
None of the 6 reported cases were here in North Carolina. And as of last night, North Carolina providers had administered 242,000 doses of the J&J vaccine. And it's important to note that the vast majority of people who received the Johnson & Johnson vaccine will only experience the expected temporary reactions.
The state has told all vaccine providers to pause giving the Johnson & Johnson vaccine. We have team coverage for you this evening. We want to start with WCNC Charlotte's Chloe Leshner, who is live at Bank of America Stadium, where Atrium Health gave out shots today. Chloe, this will impact vaccine distribution in our area.
Yeah, Fred, we heard from both major hospital systems, the county and the state today, all of them following that guidance and will temporarily stop giving the Johnson & Johnson vaccine. So some appointments will be rescheduled, others just switched so that a different product is given. But the main point, something that every expert said to us today, is that this is rare. These side effects happening in just a fraction of people. Out of an abundance of caution, the Johnson & Johnson vaccine will stay on the shelves for the next few days after 1 in 1 million of the doses given led to a rare but severe blood clot.
These events were incredibly rare, but they're serious, so we want to be careful and err on the side of caution.
State Health Secretary Mandy Cohen says there have been 242,000 doses of J&J given in the state, and there haven't been any reports of the rare blood clots here. The good news, vaccine providers have a much larger supply of the Pfizer and Moderna products because they've been out longer.
Johnson & Johnson's supply has been a little bit more erratic, so it is not the predominant vaccine, and we don't have concerns about significant loss of vaccine while this decision is being ironed out.
This is a bit of a setback, but Mecklenburg County health officials don't anticipate this will cause a major slowdown in vaccine distribution. They just have to adjust planned clinics where Johnson & Johnson would be given.
In the immediate short term, as we wait for additional data and guidance to be coming from the federal and state level, we will shift to using those 2-dose vaccines in places where we may have used the 1, but we'll continue to reassess that as more information becomes available.
And the pause in distribution may make some pause before rolling up their sleeve, but health officials say this is a sign that safety is the top priority.
Is smart, I believe, to pause and take a few days to really carefully assess the situation and come back with specific recommendations from the experts on how we move forward with this vaccine. So it's erring on the side of safety, and I don't think anyone can argue with that at this point.
Another important note, health officials say that these severe blood clots are not associated with the Pfizer or Moderna vaccines, so they are still encouraging people who have appointments to go out and get their shots. And we'll have more on some concerns that this may increase vaccine hesitancy coming up at 6 o'clock. But for now, live in Uptown, Chloe Leshner, WCNC Charlotte.